Looking at the front of the heart, so notice the little teeny blood vessel that goes at an angle like this. Okay, that's how you know you're looking at the front. The next thing you want to find is the apex, which is the point, because the apex will tell you that this is the left side and this is the right side. Okay, so wherever the apex is, that's the left side, and that will be true whether you're looking at the back or the front. So this is the back, this is the left side, this is the right side. Okay. Now the next thing you want to find when you do that is you want to look for the atria. The atria are going to be at the top and they're going to look like little ears. Okay, so this is going to be the left atrium, same side as the apex, left atrium. Okay, your right atrium is actually pretty big and it's over here. Okay, sometimes you see that, not always though. Okay, so this is the right atrium over here, and you know because it's not on the same side as the apex. Okay, now between them, what's sort of hard to see on yours is there's a tube right there. Okay, you can see it on theirs a little better. Okay, see this tube right here? So it's pretty big. It's usually white like that, and it's at an angle. Notice that it's at an angle. That's the pulmonary trunk. Okay. Immediately behind the pulmonary trunk, you should see this humongous artery right here. This is the aorta. You might see little branches coming off of it right here. Okay, but this is the aorta right here, the bigger
Right
one.
behind them.
Right behind it. Okay. Now the final vessels are going to be the vena cava. Now because you guys know your flow of blood through the heart, you should know that the vena cava is going to dump into the right atrium. So I should find the right atrium and see what connects to it. Okay, so here's my right atrium. Okay, see this thin walled tube right here? That's the superior vena cava. One of the things you should do is notice this is the largest vein in the body. Look how thin it is compared to the largest artery in the body. Okay, the arteries are much thicker. Color is different too. Yeah. Okay, so this right here is the superior vena cava. To find the inferior vena cava, you go down like this and then medial. Down and medial. And this one's going to be harder, but basically what you do is you find a little tube, and I see one right here. Okay. You guys don't have a probe, huh? Let's use these. Okay. And you have to be careful here because you want to make sure that your little tube right here connects to the right atrium. And so you need to use your tweezers or your probe, whatever you have, to double check that. Okay, so this is the inferior vena cava right there. See that hole now? It kind of tucks away when you take that away. Then again, use this to double check the superior vena cava too. Okay. Now, we're not going to know pulmonary veins because right here, this big gaping hole that leads into the left atrium, this is where the 4 pulmonary veins used to be, but they're always cut off. They're always cut off. Okay? So what you guys are going to do next is you guys are going to do a frontal section. So you're going to cut with your scalpel like this. Okay. Cut all the way through to the aorta and the pulmonary trunk.